Okay, so you're in the dentist chair and you hear a word that sounds kind of serious: perforation. What on earth does that mean? Well, in the next few minutes, we're going to break down exactly what a dental perforation is, what causes it, and, most importantly, how modern dentistry has turned this from a huge problem into a totally treatable condition. Let's dive in. So first things first, what exactly is a dental perforation? Yeah, it's one of those terms that can definitely cause a little bit of concern when you hear it, especially if it's during a procedure. Let's unpack the simple definition behind that clinical sounding name. So the official definition is a communication between the inside of the tooth and the outside. But here's an easier way to think about it. Imagine your tooth's root canal system is its internal plumbing. A perforation is basically just an accidental hole, a leak, that creates a pathway where there isn't supposed to be one. All right, so how do these little leaks actually happen? It's pretty rare for them to just show up on their own. They're usually a complication from another dental issue or procedure. So let's look at the main causes and figure out why fixing them quickly is so important. Most of the time, these things happen unintentionally during another procedure, like a root canal or when a tooth is being prepared for a crown. Dentists have a fancy word for this: iatrogenic. In some rarer cases, it can be caused by a pathologic process, which is where the body's own cells kind of start eating away at the tooth structure. Now, the good news. The outcome for a tooth with a perforation isn't just a roll of the dice. Not at all. The chance of success really depends on a few key things. A tricky location or waiting too long to fix it can definitely make things harder. But if it's in a good spot, it's repaired right away, and there's no infection, the prognosis for saving that tooth is excellent. In fact, a successful outcome really just boils down to three critical factors. I like to think of these as the three keys to saving the tooth. Let's take a look at each one. First up, location. And just like in real estate, where the perforation is on the tooth is absolutely crucial. Some spots are pretty easy to get to and seal up, but others, say near the gum line or deep down between the roots, are way more challenging. So location is the first thing that tells us how straightforward this repair is going to be. The second key is timing, and honestly, it's a bit of a race against the clock. The longer that little hole is open to all the bacteria in your mouth, the higher the risk of infection and inflammation. That's why spotting and sealing the perforation immediately is always the number one goal. And the third key? It's the material we use for the repair. You see, you can't just plug that hole with anything. The material has to be biocompatible, meaning the body won't reject it, and it has to create a perfect waterproof seal. The search for the perfect material actually led to a huge breakthrough that changed everything for the better. For decades, treating perforations was, well, it was unpredictable. It was tough. But then, a specific new material was developed that completely changed the game, turning what was once a pretty dire diagnosis into a highly fixable problem. And the hero of this story is a material called MTA, which stands for mineral trioxide aggregate. This stuff is amazing. It's a biocompatible cement that didn't just improve perforation repair, it totally revolutionized it. It's incredibly good at sealing the hole while also helping the tissue around it to heal. It's a real game changer. And hey, don't just take my word for it. The clinical research is crystal clear. This quote really says it all. When you use a modern material like MTA and there's no infection present, the prognosis is overwhelmingly favorable. And that is just fantastic news. Okay, so we've covered what they are, how they happen, and how we fix them. Let's lock in the most important points you need to walk away with. First, and most importantly, a perforation is a treatable complication, not a dental death sentence. Second, success really hangs on those three keys we talked about: location, timing, and material. Third, modern materials like MTA mean the prognosis for saving the tooth is usually excellent. And finally, the name of the game is early diagnosis and immediate repair. So let's go all the way back to that first moment of concern. You hear the word perforation, and your mind probably jumps to the worst-case scenario. Is this it? Is this the end of the road for my tooth? And the answer today is a very clear no. With the right diagnosis, quick action, and those amazing modern materials, a dental perforation is a challenge that modern dentistry is totally equipped to solve.